Hello everyone, my name is Dr. Paresis and welcome to another video. So I think most of you know that a hair transplant generally involves taking hair follicles from the back and sides of the head and transplanting or moving them to the recipient area, which tends to be at the top of the scalp where most people experience hair loss. Now, hair transplants usually grow with a very good yield, but not all hair transplants, not all hair grafts will grow after a hair transplant. Certainly not 100% of hair grafts will grow in every patient. So this is my first episode as part of my new video series where I want to take a deep dive into certain therapies that may or may not boost the hair graft growth after your hair transplant. And this is to assess whether there are any therapies out there that we can use alongside hair transplant surgery to boost the outcome, to improve the overall yield and the growth of those grafts that are put in, so that you really get the most bang for your buck if you get a hair transplant. Of course, if we increase the number of hair grafts that grow after a hair transplant, then patients are more likely to be happy with their results. In this video, I want to talk about whether Minoxidil can boost your growth of your hair grafts after a hair transplant. Now, there is a very small amount of research on whether or not this is the case. And just as a reminder, after we transplant hair grafts, there's usually a period after around about 2 to 4 weeks where the hair grafts will shed. They'll undergo what we call telogen effluvium, which is just an acute shedding episode, which is totally normal and we expect it. We actually look for it as a sign of a healthy response that the hair grafts are kind of responding to being in a new area of tissue. After the hair graft sheds, it kind of goes into this dormant phase up until around 3 months post-op. And it's at 3 months post-op when the hair graft will start to sprout a new hair. And looking at a few papers, I was able to find an interesting correlation that relates to this. So I want to highlight this particular paper here, which granted is from 1987, but essentially they looked at 12 patients with male pattern baldness treated with Minoxidil, and they started that Minoxidil application 2 days after their hair transplant surgery. They found that of those 12 patients, 2 of them did not actually experience any of that, what we call post-operative shed. So 2 of the 12 did not experience any post-operative shed. And in addition, another 2 out of the 12 did experience that classical post-operative shed that we expect, but the regrowth of the grafts, which we usually said after the shed occurs at around about 3 months, it actually occurred in less than 4 weeks in those 2 patients. So 2 patients that did not experience that classical shed and 2 patients that had a bit more of a rapid regrowth, or in essence a shorter dormant phase between the shed and the re-sprouting of the follicle. Another study here just a few years later where 16 bald men took 2% Minoxidil, and that was applied 4 weeks before surgery, stopped for 3 weeks after surgery, and then continued and then restarted again, for 3 months after surgery. And they found that 71% of their grafts did not actually shed after they applied that topical Minoxidil, which is very interesting. As I said, those patients who undergo hair transplant surgery, we expect them to undergo that post-operative shed. But 71% of the grafts that were inserted in these patients did not undergo that shed. Just a final study here, 10 years later, which looked at 40 men, of which half of them, 20, applied topical Minoxidil after actually receiving multiple hair transplant surgeries. And this found a very similar thing. There was no benefit to the number of grafts that grew in the end, but 60% of the grafts treated with topical Minoxidil did not experience that classical post-operative shed that we have discussed. And these 3 papers are interesting because they suggest that Minoxidil application after hair transplant surgery interferes with this post-operative shed. And just off the top of my head, I can think of a lot of patients who would benefit from this. After a hair transplant, most people up until that 2-week mark before they experience the shed generally look like they've just had a buzz cut. And I think if patients were able to continue that look and not experience the shed that a lot of patients dread really, I think a lot of patients would be happy to hear that after their hair transplant surgery, all they'd have is a buzz cut that would then grow to a normal full head of hair. So we've talked about how Minoxidil may interfere with the post-operative shed and the kind of progress of the hair graft after it's been transplanted, kind of from start to finish. But we haven't discussed the degree to which Minoxidil actually benefits the total number of grafts that grow from your hair transplant. And that's because there's just not enough research on this. And this is really what's stopping me from recommending post-operative Minoxidil to our hair transplant patients. because we don't yet know whether minoxidil actually boosts the overall growth of those hair grafts. In fact, we can't even rule out whether it negatively affects the overall growth of hair grafts. I would need to really be sure of this before I could recommend taking postoperative minoxidil. But what is exciting about this research is that minoxidil actually affects the growth and the progress of the hair graft after it's been transplanted. In fact, it interferes with the postoperative shed, which is very interesting and could suggest that minoxidil could have a role in speeding up the process of maturation of those hair grafts, and therefore could positively impact the overall growth or yield of grafts. But further research is really needed to confirm this, specifically a study that assesses the percentage of grafts that grow after topical minoxidil application postoperatively versus, placebo. So in conclusion, minoxidil seems to have the ability to stop the postoperative shed in some patients, which could benefit some patients in the future, but really more research is needed into whether minoxidil really boosts hair graft yield in the end. Thank you guys so much for listening. I know this video is a little bit more of a shorter one, but I hope to be making a few more videos on whether other medications and therapies boost or don't boost the number of grafts that grow after your hair transplant surgery. So stay tuned for that. Once again, my name is Dr. Paresis. I work in London, UK. At the moment I am performing hair consultations where we can discuss your genetics and where your hair loss journey is likely to take you, any medication changes that you might be, need advice on, and also if you were wanting more information about undergoing hair transplant surgery yourself. That's certainly something we can do. Do reach out to me at drparesis@gmail.com. Once again, thanks for watching.